One, two, two, three. One, two, three. In the place, the place to be. In the place.
Mic check.
Katie Robbins is on the healthcare for the 99% working group of Occupy Wall Street. I was only one of the people. I was one of the people who tried to reach out to get Occupy Wall Street interested in the story of what's happened here at St. Vincent's since it closed, and other people went to the park to ask for help as well. And as luck would have it, after a lot of time and energy, Occupy is marching here tonight to help bring the entire city's attention to the fact that there is no hospital now on the Lower West Side from 57th Street down to the Battery, and that we want to try to save the zoning of part of this building so that other investors or another hospital company can come in and open a hospital for this area.
Can you tell us about some of the events that have happened today?
Yes, actually, the march started at about 4 o'clock. There's about somewhere between 200 and 500 people in the march right now as we speak.
They started from Zuccotti?
They started from Zuccotti. Then they marched to Empire Blue Cross Blue Shield, which is very nearby the park. And right now they are en route to 110 Fifth Avenue, which is where WellCare is located. WellCare is the administrator of either Medicaid or Medicare or both. I'm not sure which, but they're being investigated for fraud, and protesters are on their way there to highlight the corruption that's taking place at that company. And from there, they are marching here to St. Vincent's to highlight what has happened here, all the shady dealings that's happening. That's led to the fact that the Rudin Management Company is trying to build a massive luxury condominium and townhouse complex right here on this site. And once they are constructed, the Rudin family stands to sell these properties at a combined value of well over $1 billion. And what Occupy Wall Street has said, the message I'm hearing from them is this is an example of greed gone bad, because people are trying to profit from the facilities that used to serve us as a full-service hospital and a trauma one-level center. And Occupy Wall Street is coming here in solidarity to be here and stand with us as we try to fight for this site to remain intact so that we can find another hospital company to open on this site.
What would you say to people who say hospitals close all the time and it's not my hospital, so...
Right. Well, the sad fact is that as I become involved here in this fight for St. Vincent's, I live in Queens actually. I want everyone to know that. Where in my neighborhood of Jackson Heights, we had a hospital closing a few years ago, and now there's only one hospital in our neighborhood called Elmhurst Hospital. It's happening all over the city. All 5 boroughs are being impacted. Not too long ago, just actually a few months ago, another hospital was in danger of closing called Peninsula Hospital Center in Far Rockaway, which is in Queens. And this is happening everywhere, and the actual inspiration for the march, the reason why Occupy Wall Street is coming here, is because they are arguing that insurance companies are putting profits before lives, and as insurance companies and as Medicare and Medicaid cut their reimbursement rates, hospitals all across the country stand to be in jeopardy because they can't operate and be paid less for the health care that they provide to people. And this is leading hospitals all over the country to be in danger of closing. So what's happening here, right now in New York City over the last few years is a sign, it's a litmus test. It's like the canary in the mine. This is what's going to happen all over the country, and we need to draw national attention to what's happening here.
The St. Vincent's
battle has dovetailed with Occupy Wall Street. You're representing some of Occupy Wall Street at this point. What does it mean to you to bring these two battles together?
Well, I think St. Vincent's is a perfect example of what the folks down on Occupy Wall Street are trying to talk about, which is that we can't let corporate greed and corporate interests take away important public resources like hospitals. And so, I mean, it's a perfect example. And also, you know, many of the folks down on Occupy Wall Street, many people in the community feel very strongly that we must have a hospital here at the site of St. Vincent's. And there's many ways to do that. You know, we're here tonight again to say they could put a couple more floors on the O'Toole building, or they could renovate and reuse the Coleman building, and we could have a hospital. And it would literally only mean reducing the significant profits the Rudin Development Corporation are going to realize from converting this from a not-for-profit public hospital into a for-profit condominium.
Now, have you had any discussions with Rudin management?
As you know, we've asked repeatedly to sit down and talk to them. They have not done that. We want to sit down. We want to find a solution. There are lots of ways that this can happen. And it's really a difference between the Rudins becoming really, 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 really rich and really, really rich. And there's a way for them to have their condos and to make their money, and for the people of this community to still have a hospital. And so we're here tonight to remind them of that.
So when Occupy Wall Street comes here, finally gets you, you just made an announcement that they're on their way.
Yes.
What do you want that message? What do you want that to symbolize to New York City?
Well, we stand in solidarity with the folks on Occupy Wall Street. We stand in solidarity with everybody who's fighting to restore public services and a public sector. This symbolizes the power that we as a community have, the power that the people have, and that we have a government, a democratic government, that is created specifically to empower the people. And this symbolizes all of us coming together to make sure that when our resources are taken away, like hospitals, some of the most important vital resources that a community can have, that we are going to respond. We're not going to go away. We're not going to just be quiet. We're not going to be made to feel like we're doing something wrong. We are here righting the wrong of the closure, the wrongful closure of this hospital. And we're going to keep showing up. It's close to 2 years now that this hospital has been closed, and we're going to keep showing up until we get a hospital for our community. We shouldn't have to be fighting this hard. There are many people who are in positions of power who are supposed to protect us from this very situation, and when they turn their backs on us, what's amazing and what's affirming is that the people step forward and they show up, and we're showing up for ourselves here to demand that a hospital be restored at the site of St. Vincent's.
This is absolutely a crime that they've closed this. In fact, when my son was not quite 3 years old, he would have died if this hadn't been here, because he had something called a bronchospasm where he couldn't breathe, and the pediatrician said it was a very close call. And we've been told by this group that other people have been died because they couldn't get to hospitals soon enough, because this was their local one and they couldn't get wherever it was, uptown, through traffic. This is just, it's all tied together. I mean, I know from my own experience with insurance that they're always finding something to deny, and we're lucky enough we've had insurance. After I lost a job, it's cost us a fortune to pay for it ourselves. And people we know don't have any insurance. It's just terrible. And even the people who do, the hospitals are dangerous. And supposedly we don't have any jobs for people. Anybody who's had anybody in a hospital knows that they always say they're understaffed. That means they don't pay for enough care. My father died at Bellevue because the nursing care there was so negligent that he got a huge decubitus ulcer because they wouldn't change his sheets because he got an infection that caused diarrhea. And if they need to find jobs for people, there are a lot of jobs that people need to fulfill in hospitals, and they say they can't find anybody. That's because they're not willing to pay for human care. That's the way the system works. But it's not just Wall Street, it's the way this system works. It's obvious in just about everything. I saw something great, a really great comment on the internet tonight about they're exporting democracy all over the world and killing people to do it, but we can't have democracy here. We can't protest in Oakland. We can't protest in Atlanta. It's outrageous. And I know about this. I was laid off, supposedly at 60, from a huge Wall Street law firm that had hired young people a year before to replace older people. It is just, the whole system up and down is based on profit, and it's a crime, and it's the greatest thing that people are organizing. What's tough is that there has never been a history of the kind of labor revolutionary parties in the United States that there are in Europe. So this is fantastic, the kind of consciousness it's spreading for people. There are hundreds of years of general strikes in France and the Paris Commune, and here there was a huge labor movement, and there have been movements like civil rights, but there's no organized party. And what's so great about this is it's exposing the so-called liberals. They still represent the same class of people who will continue to drive us into the ground. That's what this is about. It's a whole crisis of capitalism. I wish I could tell you more. The group I was in, the Socialist Workers' Party, has very, very good analysis about that. And their view is essentially that capitalism has found that investing in factories doesn't make as much money as in speculative interest. But there are plenty of people. The factories are there. The people are there. There's tons of things that have to be done urgently, like hospitals and schools. And suddenly there's no money for that. It's ridiculous.
That's what I heard. Okay, well, so we'll see you. Where are you?
110 Fifth Avenue, which is 16th Street.
After that, they are coming here.
After that, they are coming here.
By the way,
I
think I'm on Keith Olbermann tonight.
think I'm on Keith Olbermann tonight.
We're all in this together.
We're all in this together.
Healthcare for the 99%.
Healthcare for the 99%.
And it is completely ridiculous
And it is completely ridiculous
that there is no hospital
that there is no hospital
and no emergency room
and no emergency room
on the west side of Manhattan
on the west side of Manhattan
below 57th Street.
below 57th Street.
If we had any rational
If we had any rational
health care and planning,
healthcare planning,
we would carefully space out where our hospitals were.
we would carefully space out where our hospitals were.
We can have that
We can have that
with a national health program,
with a national health program,
single payer,
single payer,
expanded and improved
expanded and improved
Medicare for all.
Medicare for all.
Anybody else want to join to speak out?
Well, we're waiting until they get. I'm Yetta Curl from the Coalition for the Village Hospital.
Back on April 30th, 2010, I called for a revolution. That was the only thing that was going to get a hospital here. And that's exactly what we're getting with Occupy Wall Street. They're coming down here. They are the beginning of the revolution, and I hope they never give up, because it's really, really important that people join Occupy Wall Street and really get the message out there about crony capitalism, because real estate development deals. That's why St. Vincent's isn't here anymore. Real estate development deals behind closed doors and crony capitalism. And we're waiting patiently right now for them to come, and it's exciting because they're helping us put the spotlight on this program, on this problem.
What do you think about how the nurses unions across the country have embraced the Occupy movement?
Nurses embrace anybody that's in the right. And we like people who are right about things. So yes, we've embraced Occupy Wall Street. I know that there are nurses taking care of the people in all of the camps all over the globe. I also know that some have been arrested. That doesn't make me too happy because we need to take care of our licenses so that we can be around to take care of sick people.
Thank you very much.
Okay.
Can I ask her a question? When my father was in the hospital, he could never get care because they always said, we're understaffed. We have this army of unemployed and they can't find jobs for people. I would like to know your experience about understaffed.
Understaffed? Do you want my experience about
Yes,
understaffed?
yeah.
I never worked at St. Vincent's where we were fully staffed. I was the president of the union, so I had to do a lot of the grievances here at St. Vincent's. We were understaffed on almost every floor. Especially our intensive care units, where it should be 2 to 1, we were 3 to 1, sometimes 4 to 1. Okay, and that's what upsets me greatly because looking at the money that's being spent, there was just $50 million spent on the lawyers for the bankruptcy. $50 million. Meantime, while we're working on the floors, we couldn't find blood pressure cuffs, we couldn't find glucose monitoring machines, all sorts of things. So what was going on behind closed doors while we're busy trying to take care of people is unconscionable, really what went on. And yes, your father, in all, I should say in all hospitals, but in many hospitals there is a lack of staffing.
And in nursing, there is no nursing home care for anybody. That's a crisis across the country.
Yeah.
And so people can't get jobs and they don't have any, they're a shortage. What's that tell us?
Money. Right?
Yeah, once people are old and they can't get a profit on it, or if they're young and they can't make money, for them there's no child care and there's no elder care.
Right. And we need to do something about it. That's why we're here tonight.
Oh, thank you for what you're doing.
Well, thank you for coming.
hospital. We need a 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 hospital.
Hear that, Rudin family! Hear that, Rudin family! We need a hospital!
We need a hospital! We need a hospital! People over profits.
Occupy St. Vincent!
Mic check!
Mic check!
Mic check!
Mic check!
We're going to start the teaching!
We're going to start the teaching!
If everyone wants to come over here!
Everyone wants to come over here!
My check. Okay. The public servants of New York State
The public servants of New York State
have turned their backs on the community.
have turned their backs on the community.
From Nadler, Cuomo, and Dwayne,
Cuomo and Dwayne,
Godfrey, Glick, and Bloomberg,
Godfrey, Glick, and Bloomberg,
Quinn, Hamilton, and Holyman
Quinn, Hamilton, and Holyman,
all have insurance.
all have insurance.
Most are wealthy.
Most are wealthy.
And it appears they don't care anything about a hospital in our lives. They have done nothing.
They have done nothing
To hold the Roman Catholic Church
to hold the Roman Catholic Church
or the managers of St. Vincent's
or the managers of St. Vincent's
for the accounting irregularities that put St. Vincent's into bankruptcy court. Blood lies on federal judge Celia Morris.
Blood lies on Celia Morris.
Hands and her robe
Hands and her robe.
for her part in abandoning the New York community.
For her part in abandoning the New York community.
All doctors
All doctors
and laymen, except for one on the New York State Health Planning Council,
except for one on the New York State Planning Council,
voted for North Shore, Long Island,
voted for North Shore, Long Island,
Jewish Hospital, Lenox Hill Hospital, and the Rudin Organization
an organization
to open an upscale urgent room.
to open an upscale urgent room.
They call it an emergency room,
They call it an emergency room,
with the council stating that a hospital can have only 2 beds.
with a council that's in a hospital that have only 2 beds.
All elected officials
All elected officials
and appointed wonks
and appointed ones
join Chris Quinn
join Chris Quinn
in the New York Hall of Shame
in the New York Hall of Shame
for not bringing a full-service hospital
for not bringing a full-service hospital
to Manhattan's West Side
to Manhattan's West Side
with 1.5 million New Yorkers.
with 1.5 million New Yorkers.
We have a banner that they will be added to, and and we have a map of the 4 quadrants of Manhattan. It shows where the hospital beds are, and there are no hospital beds for 57th Street.
and there are no hospital beds at 57th Street.
To the Battery.
To the Battery.
On the back, there are names and phone numbers.
On the back there are names and phone numbers.
Get a copy of this.
Get a copy of this.
And use your phones to call all these individuals and say, we want a hospital.
Use your phone to call these individuals and say hospital.
Thank you.
Thank
Mic check! Mic check!
you. Check.
Mic check!
Check.
representing the Coalition for a New Village Hospital.
I'm an attorney representing the Coalition for a New Village Hospital.
Government is supposed to be of the people.
Government is supposed to be of the people.
By the people.
By the people.
And for the people.
And for the people.
Government is supposed to protect the people.
Government is supposed to protect the people.
Not the corporations.
Not the corporations.
We pay taxes to our government.
We pay taxes to our government.
So that our government can build.
So that our government can build.
Schools.
Schools.
And parks.
And parks.
And hospitals.
And hospitals.
St. Vincent's was a public entity.
St. Vincent's was a public entity.
That means it was owned by the people.
That means it was owned by the people.
We use tax dollars to build.
We use tax dollars to build.
Emergency rooms.
Emergency rooms.
Hospital beds.
Hospital beds.
Pediatric units.
Pediatric units.
HIV/AIDS services.
HIV/AIDS services.
And much, much more.
And much, much more.
We want
our
hospital back.
Our hospital back.
The Rudin Development Corporation. Took our hospital.
Took our hospital.
With the help of those.
With the help of those.
Who were supposed to protect us against.
Who were supposed to protect us against.
Corporations like.
The
Rudin Management Company.
The Rudin Management Company.
So they could turn our hospital.
So they could turn our hospital
Into condominiums.
into condominiums.
And sell our publicly owned hospital.
And sell our publicly owned hospital
For billions of dollars.
for billions of dollars.
To put in their pocket.
To put in their pockets.
Those billions of dollars.
Those billions of dollars
Were our taxpayer dollars.
for our taxpayer dollars.
We want
Our
hospital back.
our hospital back.
For a small reduction in their profits.
For a small reduction in their profits.
They could put a hospital at O'Toole.
They could put a hospital at O'Toole.
Or at Coleman.
Or at Coleman.
But they don't want to.
But they don't want to.
And nobody is making them.
And nobody is making them.
Because people who run corporations
Because people who run corporations
have lots of money
have lots of money
to give to public relations firms
to give to public relations firms
and white shoe law firms
and white shoe law firms
and political campaigns.
and political campaigns.
That money would be better used
That money would be better used
for things like health care
for things like health care
and hospitals.
and hospitals.
We want our hospital back.
Our hospital back.
Thank you.
Thank you.
Hi, my name is David Kaufman.
Hi, my name is David Kaufman.
I'm a physician in this community for over 30 years.
I'm a physician in this community for over 30 years.
18 months ago, this hospital closed.
18 months ago, this hospital closed.
Before it closed, this emergency room treated 61,000 people a year.
This emergency room treated 61,000 people a year.
13,500 were so sick they had to be admitted immediately.
13,500 were so sick they had to be admitted immediately.
Every day of the year, 350 people
Every day of the year, 350 people
were in the hospital.
were in the hospital.
Every day and every week,
Every day and every week,
hundreds of people had operations.
hundreds of people had operations.
Now we have nothing.
Now we have nothing.
Our coalition of 10,000 people have attended and spoken at every public meeting that was available to us. For 18 months. We have requested meetings. With the Commissioner of Health. The Mayor. The Attorney General. City Council members like Quinn. Even the Rudins. And North Shore LIJ representatives. The answer? Silence. No response. Nothing. These people are elected politicians, regulators, and one percenters, simply do not care. We have over 1 million people with no readily accessible health care. The 1% who live on the Upper East Side have over 4,000 hospital beds, 5 emergency rooms to treat their heart attacks and strokes. What do we have here? Bupkis. We are being offered an urgent care center on steroids. With 2 hospital beds. That's right, 2 beds. For 1 million people. While 325,000 residents. On the Upper East Side. Have 4,000 beds and 5 emergency rooms. I am a physician. I treat real people with real life-threatening diseases. I am telling you, as I have tried to tell all, the politicians and regulators, so-called guardians of our health, I am telling you that people are dying and will continue to die. Heart attacks and strokes do not go on pause for traffic jams. The clock does not stop ticking. We demand a hospital. We demand a real full-service emergency room. We demand health care for the 99%. Thank you.
Mic check.
My name is Eileen Dunn. I was a nurse at St. Vincent's for 25 years. On April 30th, when we closed, I called for a revolution in this community. Occupy Wall Street, you're giving us that revolution! You play an important role! In this world! In this country! And right here at St. Vincent's! You are looking at the greatest crony capitalism everybody, Wall Street and insurgents.
We took care of everybody, Wall Street and insurgents.
I'm a little bit emotional.
I'm a little bit emotional.
Because they took my job and my people that I loved from me.
Because they took my job and my people that I loved from me.
Everyone deserves health care.
Everyone deserves health care.
Single payer for all.
Single payer for all.
I can't hear you. When will they wake up?
When will they wake up?
Do not give up.
Do not give up.
Make the politicians listen.
Make the politicians listen.
We have tried for 18 months.
We have tried for 18 months.
To make the politicians listen.
To make the politicians listen.
With Occupy Wall Street's help.
With Occupy Wall Street's help.
Maybe they will hear us tonight.
Maybe they will hear us tonight.
Thank you all for coming.
Thank you all for coming.
And come back soon.
And come back soon.
God bless. God help America.
God help America.
And God bless America.
And God bless America.
Thank you.
Mic check. Mic check. The Coalition for a New Village Hospital. Welcomes Occupy Wall Street. To St. Vincent's Hospital. Our priorities in this country and this city are seriously messed up. Tens of millions of Americans do not have health insurance. While our health insurance industry focuses on providing only that care that makes money. Okay. You can't find a better example. Than right here. This hospital served over 40% Medicaid patients. The rest of its clientele were of the 99%. The Rudin organization wants to tear this hospital down to build luxury condominiums. We need more luxury condominiums. Like a hole in the head.
Another war.
We demand health care for all. We demand a hospital. Thank you.
Okay, say your speech. My name's Audrey.
My name's Audrey.
My name's Audrey.
And I just want to let you know that
That
we all need a hospital and we have our rights.
That we all need a hospital and we have our rights.
Those people who are taking away our hospital.
Those people who are taking away our hospital.
Shouldn't. It's our health care.
Shouldn't. It's our health care.
Thank you.
Thanks, Audrey.
Right on, Audrey.
Go, Audrey.
Yeah. All right. Thanks for all your
Mike Jack. My name is Jay. I was a volunteer EMT. And a cancer patient at St. Vincent's. We need a hospital.
For all the people in the ambulances.
For all the people in the ambulances.
Who are gonna die stopped in traffic.
Who are gonna die stopped in traffic.
All the people that I've cared for.
All the people that I've cared for.
For over 30 years.
For over 30 years.
Who were bleeding.
Who were bleeding.
Whose hearts were stopped.
Whose hearts were stopped.
Who couldn't breathe.
Who couldn't breathe.
And we need a hospital.
And we need a hospital.
Because we need our blood.
Because we need our blood.
We need our hearts beating.
We need our hearts beating.
We need to breathe.
We need to breathe.
We have a right.
We have a right.
With all the wealth in this country.
With all the wealth in this country.
To live our full lives.
To live our full lives.
And not end prematurely.
And not end prematurely.
And not have our families cry.
And not have our families cry.
And not lay to waste all we have built.
And not lay to waste all we have built.
And to express our talents.
And to express our talents.
To express our love.
To express our love.
To our fullest capacity.
To our fullest capacity.
So we need hospital care.
So we need hospital care.
And we need it for all.
And we need it for all.
And we need health care for all.
And we need health care for all.
We need single payer for this country.
We need single payer for this country.
So that we have care in our lives.
So that we have care in our lives.
And all of us who have dedicated our lives.
And all of us who have dedicated our lives.
To caring for patients.
To caring for patients.
24/7.
24/7.
We'll have a place to go.
We'll have a place to go.
To save our own lives.
To save our own lives.
We need a hospital.
We need a hospital.
We need a hospital.
We need a hospital. We need a hospital. We need a hospital. We need a hospital. We need a hospital. We need a hospital. We need a hospital. We need a hospital.
Mic
We
check.
need a hospital.
Mic check.
Mic check. My life was saved
My life was saved
by St. Vincent's Hospital.
by St. Vincent's Hospital.
I live in the neighborhood.
I live in the neighborhood.
I went into anaphylactic shock.
I went into anaphylactic shock.
They brought me here in 2 minutes.
They brought me in 2 minutes.
In 2 minutes.
If I had to go farther,
If I had to go farther,
I probably would have died.
I probably would have died.
I need a hospital close to my home.
I need a hospital close to my home.
This is a conspiracy to reduce our care.
This is a conspiracy to reduce our care.
We need care locally.
We need care locally.
We need hospitals in every neighborhood.
We need hospitals in every neighborhood.
This must become a revived. This must become a revived hospital.
A revived hospital.
Thank you.
Thank you.
Mic check.
Mic check.
Mic check.
Mic check.
I'm Katie.
I'm Katie.
I'm here with healthcare for the 99%.
I'm here with healthcare for the 99%.
A working group of Occupy Wall Street.
A working group of Occupy Wall Street.
We believe that healthcare is a human right.
We believe that healthcare is a human right.
And we can tax the 1%
And we can tax the 1%
and fund a single-payer healthcare system for everyone.
And fund a single-payer healthcare system for everyone.
Today we marched to WellPoint. The largest publicly traded insurance company in the country. Their CEO made $13 million. Last year. Then we marched to WellCare. The for-profit administrator of Medicare and Medicaid. They're being investigated for illegally siphoning $400 to $600 million from state health insurance programs. Then we marched here. To St. Vincent's Hospital. Whose closure is a casualty of a for-profit healthcare system. If we had a system that met human needs, this hospital would not be closed. But we have a healthcare system that feeds corporate greed and puts profits over patients. So the fight here at St. Vincent's is all of our fight. Let's keep fighting.
All over America.
What do we need?
Hospital!
When do we need it?
Now!
What do we need?
A hospital!
When do we need it?
Now!
My name is Christopher.
10
years ago, my daughter was born at this hospital.
10 years ago, my daughter was born at this hospital.
On that day, 2 Port Authority police officers drove my wife here to give birth.
On that day, my Port Authority police officers drove my wife here to give birth.
Thank you to them.
Thank you to them.
Nowadays, there aren't any kids being born here.
Nowadays, there aren't any kids being born here.
They're being born in taxi cabs on the west side.
They're being born in taxi cabs on the west side.
People are having heart attacks in taxi cabs on the west side.
People are having heart attacks in taxi cabs on the west side.
That's no place to give birth or have a heart attack.
That's no place to give birth or have a heart attack.
10 days after my daughter was born, 9/11 happened.
10 days after my daughter was born, 9/11 happened.
We lost 3,000 police officers, firefighters, and citizens.
We lost 3,000 police officers, firefighters, and citizens.
The whole planet pays homage to Ground Zero.
The whole planet pays homage to Ground Zero.
But they pay lip service to the hospital that was on the front lines that day.
Yes. They pay lip service to the hospital that was on the front lines that
Politicians! Mayor Bloomberg! Where were you when they closed this hospital?
Where were you when they closed this hospital?
Where are you now?
Where are you now?
When will we hear from you?
When will we hear from you?
Bring back our hospital!
Bring back our hospital!
Taxpayers paid for it.
Taxpayers paid for it.
It serves Wall Street and everyone.
It serves Wall Street and everyone.
This is not something that we should forget.
This is not something that we should forget.
And we will not be forgotten.
And we will not be forgotten.
Save St. Vincent's.
Save St. Vincent's.
Thank you.
preemie twins. 21 years ago.
21 years ago.
Before I left the hospital, I was given instructions in pediatric CPR. I came home with one of my babies on a monitor. He did turn blue. I wrapped him in a blanket. After administering baby CPR. Because he was blue. Crying in a blanket. Running down the street. To pediatric emergency. At St. Vincent's. 5 people. 5 wonderful healers. 5 experts. In pediatric care. And Sister Margaret. Helped us. And took care of my son. He survived. I am forever. In debt. To this hospital. Besides the fact that my other son also almost died. Because he had severe asthma. I have run down this street. On multiple occasions. I am so grateful that this hospital was a part of my community for 160 years. This is the hospital where Titanic survivors came to be comforted and treated. This is the hospital where the triangle shirtwaist victims jumped out of a building because labor laws and fire department regulations had not caught up yet with industrialization. This is the hospital that rescued young Italian and Jewish immigrant women and men who jumped out of a building because they were locked inside to make shirts. Laws, regulations for the fire department, for health care, changed as a result of those incidents. 9/11 was already mentioned. Landing on the Hudson is another catastrophe that happened here. Luckily, no one died. We just had a hurricane and an earthquake enter our city in less than 1 week. How many red flags have to go up for the politicians, for our mayor, to pay attention? This community needs health care. We did a pandemic response a week ago. There were regulations put in line for a pandemic response. Whether it be a flu or an explosion in a subway. We have no response at this time. And emergency precautions for all of us on the west side of Manhattan. What
is everyone thinking here? I want you to be angry. Our lives. Everyone who works here. Everyone who visits. Our lives are in jeopardy. Thank you.
Healthcare for all! 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 Healthcare for all!
Healthcare for all. Healthcare for all.
Hi, I'm Katie Robbins. I'm an activist with Healthcare Now New York City and Healthcare for the 99%, which is working with Occupy Wall Street.
Was that in existence before Occupy Wall Street?
Healthcare for the 99% is a new group, working group of Occupy Wall Street.
And why was it begun?
A lot of us felt like one of the best examples of inequality in our country is in healthcare. We have 50 million people who are uninsured, another 50 million who are underinsured, and so we wanted to bring that message into the Occupy Wall Street actions. So we started Healthcare for the 99%. We believe healthcare is a human right. We believe we have the resources in this country to provide high quality healthcare for everyone. But in order to do that, we have to challenge corporate greed and make sure the 1% pays their fair share so that we can have a functioning, effective, single-payer, universal healthcare system.
And why the collaboration with local activists who are trying to reopen St. Vincent's?
Well, we think that the St. Vincent's folks, the coalition that's been fighting to get a hospital in this community, has had a really hard time meeting their demand. The elected officials here aren't hearing them, and the 1% that controls this area of the island is able to make a lot of decisions on behalf of the community, ignoring the community's input. So we wanted to bring our message of how the Lower West Side of Manhattan needs a hospital, combine it with the Occupy Wall Street efforts. We think that the closing of St. Vincent's is a casualty of a for-profit healthcare system. They're not thinking about the human need in this community, they're thinking about what's going to make the most money. So it fits right into our message to get Wall Street out of healthcare.
You had 2 more questions. You had a march today. How did it go?
The march was awesome. I think we had 1,000 people out marching from Liberty Square. We first went to Well Point, which is actually right across the street from Liberty Square. They are the largest health insurance company in the country. Their CEO made $13 million last year. Then we headed up to WellCare, which is the for-profit administrator of Medicare and Medicaid, and they are being investigated for illegally siphoning $400 to $600 million from our public insurance programs. And then we ended up here at St. Vincent's, and the energy was amazing, and the community was ready to receive the Occupy Wall Street message, and it's been awesome.
Lastly, for people who are completely bewildered by Occupy Wall Street, what do you think is its ultimate or overall message?
I think that Occupy Wall Street, the strength is that it's a million people and a million different messages. I mean, I don't think it's about having one demand or one message, but it's clear that the target is right on. It's Wall Street, and it's the greed that's happening there every day that makes it so that people can't meet their human needs. And that might be healthcare, housing, food, jobs. The list can go on and on.
So thank you very much.
Awesome.